5 minutes, as you know.
Question came up asking Mr. Hoskins' staff about getting intergovernmental agencies like housing involved and the addictions. And that's a great idea because, it's a social determinant of health, all this housing, etc.
Right.
And the ministry says it stands behind its October 12th statement on the overdose policy. We still haven't seen any action for the safer consumption sites yet. It's a mess. And also yesterday at the LHIN's, harm reduction was at the very bottom of the pile. Not much funding going that, and harm reduction saves the taxpayer. Every dollar you spend on harm reduction saves the taxpayer $4. So any safer consumption sites is going to be a good idea. Faster the better. And so I asked one question when question time came up. I asked the panel, a family member has these signs: coma, labored breathing, cyanotic, pinpoint pupils. What first aid treatment do you want ASAP? Not one of the panel members said a word. Complete silence. Anyone in first aid knows that's signs of a drug overdose or any respiratory emergency. You better be giving them air. They can't even save their own family members' lives, nor their souls. Utter nonsense. We should stop teaching that chest compressions only for drug overdose in 22 health districts in this province. It's costing you a fortune because a doctor or paramedic or a nurse can't tell the cause of respiratory emergency, but knows to give air ASAP, diagnose and treat later. When you empower lay persons what they think is a life-saving technique, they're only too eager to go out and do it. And it's happening. Because a lot of these people, these disenfranchised, travel by foot. And they're in the subway system. And there's a scream, a gas goes up and people run the other way. They're running towards it. Just trying to save lives and the taxpayer fortune. Simple. Don't know why I have a problem. I could tell you a little story how it increases drug abuse too. I was taking a course, Salvation Army, about social work. We had one of our teachers was an addictions counselor. Salvation Army had in the front window at Toronto Public Health chest compressions for drug overdose. When he became aware that it was the worst thing he could do, he went on a drinking binge. Him and his wife both worked for the Salvation Army. His wife growls at me. I says, look, take that silly sign down because you're making everybody sick. The teacher of theology that we had in this course first started off in chemistry at the University of Toronto. Every chemist knows any poisoning, any drug overdose, give them air. The minister also has multiple sclerosis. When his muscles become too weak to breathe, he'll be put on a ventilator. And every minister knows the end of life training from their theology courses. People that are kept comfortable when they're terminally ill. They're overdose narcotics. Every minister has been trained in this to explain to the family members what happens. Person stops breathing. Heart doesn't stop until the brain does. Thanks a lot. Have a great day.
Thank you.